Hi, my name is Caleb Yang, and I will be talking about prenatal acetaminophen use and autism, the correlation versus the causation. Recent headlines and scientific papers have recently raised concerns about whether prenatal Tylenol, acetaminophen exposure could be linked to autism. So in this video, I'm just going to break it down scientifically, what science says, medical experts, what they kind of recommend, why it's important. Those are kind of the main key aspects that I was focusing on. Looking at why. So, concerned about Tylenol and autism grew from, again, media headlines and early observational studies. Lots of influential people came out this year, especially saying how it can cause Tylenol use in prenatal usage can cause um, how it can cause different side effects in the fetus. One including autism. Because Tylenol is been such longly considered a safe option for both pain and fever in pregnancy, which is very common. Um, the possibility of a link is very concerning. Understandably, it causes created anxiety in new mothers. Um, it's very important, this topic, for the public to understand. It's a perfect example of how the nature of science can help us interpret critical research. My central question was, does autism stem from Tylenol, or is it an observational association between the two? Um, Obviously, current evidence shows association in some studies, but not causation hasn't been fully proven yet. Going deeper into those observational studies, some studies reported small increases in these autism and ADHD like symptoms. Several observational reports did show some, but the studies can't separate the medication from other factors like untreated fever, underlying illnesses, or genetics. Higher quality studies, though, have confounders that are controlled, which show weaker associations, or the associations disappear completely. One of the main ones was a sibling controlled study. They found no significant link to autism between siblings whose parents used Tylenol prenatally. Um, Research found, again, no significant association in not only autism but ADHD along with intellectual disability. There is a strong suggestion that prior associations might be due to familial or genetic factors, not Tylenol usage itself. Looking at the biological processes, Tylenol, acetaminophen, can pass through the placenta to the fetus. Researchers propose mechanisms, including like oxidative stress or epigenetic changes, that could hypothetically affect the neurodevelopment of the fetus. However, these mechanisms remain unconfirmed in humans, as most supporting evidence comes from animal or cellular models, which again can't be directly extrapolated, which um, extrapolated to the human pregnancy. It's not confirmed in humans. Looking at the organismal biology aspect, at the organismal level, some studies have looked at behavioral outcomes like autism or the ADHD symptoms. The risks they tend to be extremely small. So often less than a tenth of a percentage. Um, the small effects commonly disappear when researchers look at strongly designed studies, um, which kind of shows that the more accurate your study is, the more accurate your results will be. Looking at the global effects and population level perspective, even a small risk would matter when looking at these studies, just because Tylenol is such globally used. While the scientific community closely monitors new evidence, over the past decade, recommendations have shifted from assuming Tylenol is not correlated and it's safe to acknowledging its uncertainty because of like all this new data that's coming out. The ethical and social ramifications include risk of misinformation, causing fear in new mothers, pregnant people avoiding treatment, which could be detrimental. Avoiding fever can pose as a more developmental risk. And then it's also to avoid blaming the mothers, avoid the blame caused from fear, because many outcomes can occur when things like these go untreated, such as fever and developmental risks bringing up from it. Clear and accurate communication is essential. Looking at expert recommendations, so the American College of Obstetricians and Gynecologists, the Society of for Maternal Fetal Medicine, and the FDA, um, they emphasize that the current evidence doesn't show causation. They continue to recommend Tylenol use as it's the safest option for treating pain and fever in pregnancy, while medically necessary, but they also encourage using the lowest effective dose. Do not overdo it, as it still could be a possible risk. In summary, while some observational studies show association between the prenatal Tylenol use and autism, higher quality evidence doesn't support this causal link. The data is inconsistent, often confounded, and far from definitive. The topic highlights very important scientific literacy, especially the ability to distinguish causation or correlation from causation in something so important when looking at different fetal growth. And yeah.